So today's topic is about abrasion. Any kind of injury we get, the first part, any kind of scrubbing action for that one. The first thing is the abrasion. The picture you see, the abrasion arc, which is happening when you rub anything to a rough surface or get in contact with any rough surface. The first part of things which is called as abrasion or abrasion marks. In the case of forensic aspects, abrasion is the first part of injury which is held, and it has a medical legal importance. In the cases of rape, sexual assault, for any kind of murder kind of conditions, or for suicide cases, this abrasion marks an important thing. And it is also called this gravel rash because any kind of rough gravel or rough matter, when it comes in contact with it, leads to this kind of features. So there will be first hand destruction of skin layer. The skin layer is destructed in the first layer, and mostly the superficial layers of epidermis is only indulged in this thing, and mostly the thickness of skin will be in the about 1.6 mm is only affected here. So the mechanism, there is a friction which is attained there. Against a rough surface, there is a friction crossed, and thereby a compression is maintained. So thereby there is a lateral rubbing action, and when there is a fall on rough surfaces also, this abrasion is formed. Sometimes in the case of vehicular accidents, in the motor accidents and all, the vehicle drags the person. So when the dragging by the roads is there also the rubbing is seen. So for that one also the abrasion is seen. Sometimes the fingernails scrubbing also with that abrasion is made. The teeth bite or for the thorns also these abrasions are. So if sufficient friction is applied, there is a partial or complete removal of epithelium, and then the super layer of epidermis is also changed there. Wherein there is more friction, other than the epidermis, the dermis layer is also involved in that one. So then it is not called as abrasion, it comes to the second layer of that one. The filled thickness of the skin is damaged in places, and that is not a regular or continuous pattern. Here, part only the thickness of skin is damaged there. Uninterrupted, it is not uninterrupted, it is interrupted skin damage which is seen there. Mostly not in a regular pattern, in an irregular manner, and with the intact epidermis remains within area of abrasion. So the rougher the surface, more rapidly the movement of skin will be also there, and there will be the deeper the injury. So the exposed raw surface will be there. It will be covered by the exudation of lymph and blood. So mainly the blood and the lymph will be exudating from there, and thereby there will be a protective covering which is made. That is called as mostly the scab or the crust region. Mostly when the abrasion is made, it heals within 1 or 2 weeks. There will be a yellowish layer which is formed there. That is mainly called as the scab or the crust. That is the first the damaged skin is healed there. So that is happening there. So the simple injuries will be there, which is bleeding slightly and then heal rapidly, and the scar is not formed. So the large abrasions will be there, which causes severe pain and bleeding will be there. So here the types when we see, the first will be the scratches are called as the linear abrasion. So the abrasion in full length with no significant width or superficial incision, that is called as the scratches or the linear abrasion. The other one is a point scratch, mostly from the tip of the knife or with a razor. When you blade that one, there will be a point scratch which is happening there. And the fingernail abrasions means the parallel linear scratches will be formed there. Mostly the pointed nails will be leading to this kind of fingernail abrasions. So the grazes will be sliding, scraping, for grinding abrasion. So the movement between the skin and some rough surface, this kind of grazes will be seen there. The other one is called as the pressure abrasion. That is friction. More the friction is applied, that a crushing action is applied there. That is, the superficial layers of epidermis is crushed there, and there will be a bruise of the surrounding area. The yellowish color will be there on the surroundings areas also. The other one is called as the impact abrasion. That is contact or imprint abrasion. Any kind of rough object gives an impact on your skin, thereby a force is applied, and that force, when it is applied at right angle to the skin surface, then kind of impact abrasion is there. The other one is a patent abrasion, most commonly seen inflicting instruments, with any kind of inflicting instruments or by unique means. The causation force is applied. When it is applied at right angle to the surface of the skin, this kind of scenes are seen. Mostly the imprint of a bicycle chain or any kind of force applied metals also will be there, or any kind of coarse fabric is attached to our skin, so with that one also an abrasion is made. Sometimes with the slippers also this can made, or for sometimes a spiral or electric wire, with that one also made. Any kind of rope or hard things which is tightly scheduled to our skin will also produce this kind of patterned abrasion, or any kind of knife also. The main thing is कंसिडर इन द एज ऑफ एब्रेशन, यानी कि वो फ्रेश या फिर ब्राइट रेड कलर के ऊपर वो डिपेंड करेगा कितने टाइम हो गया ये एब्रेशन पास हो गया. विद इन 12 to 24 hours मीन दैट द lymph and blood will be there which dries up, and thereby a bright red colored scab या फिर crust is formed there. If it is 2 to 3 days, there is reddish brown. Slowly the reddish color changes into reddish brown color, and within 4 to 7 days dark brown to brownish black color. Sometimes when you see the injuries, slowly it can turn into brownish black skin, and after 7 days the scalp will slowly dry up and the surrounding area will be shrinking, and the outermost scab or the crust layer will slowly fall off, or when you remove it you will not have any pain there. And then the next is the antemortem and postmortem abrasion. In the medical legal aspects, antemortem and postmortem abrasion is very important. So the abrasion which is produced after the death, when a body is dragged away from the scene of crime, यानी कि डेथ होने के बाद वहाँ से वो डेड बॉडी को अगर ड्रैग करते लेते हैं तो वो पोस्टमार्टम ऑपरेशंस वगैरह सीन. डेथ के बाद एपिडर्मिस जो होते हैं बहुत ही स्टिफ होते हैं, लेदरी होते हैं, ब्राउन कलर का होते हैं. समटाइम्स व्हेन इट इज मेड इट इज मिस्टेकन फॉर द बर्न्स. The exudation there will be more in the case of before the death, because this is a live body and the scab will be slightly raised also. In the postmortem after death condition, any kind of secretions or exudations will stop, so it will be very less, so the scab will be lying slightly below the level of skin there. In the microscopical examination, intravital reaction and congestion will be seen there. No intravital reaction and congestion will be there here for the postmortem. And the medical legal importance is that impact in the direction of the force will be there. External sign of any serious internal injury will be there. Patterned abrasions will be helpful in connecting the wound with the object which produced them. And thereby the most important part is that the age of injury can be determined. The character and manner of the injury will not be known there. Sometimes in the cases of throttling cases, the abrasion can be made with the fingernails, especially the victim is the crime person is having very pointed fingernails. Sometimes in that one the throttling can be very much seen. In that one fingernail marks will be seen. All the 10 fingers will be seen there in the case of severe throttling. In the smothering cases, sometimes a pillow or something is kept for the smothering purpose. The abrasion will be seen on the mouth and the nose region, because that is the more pressure areas. In the cases of sexual assault condition, there will be abrasion on the breast region, genital region, thighs, especially the inner side of the thighs, and around the anus region there will be the abrasion seen. So the abrasion on the face of the assailant, there will be indicating a struggle. In the case of murder and all, there will be any kind of abrasion on the face. It indicates that there was violence or struggle involved here. In the case of abrasion on the victim, there will be fingernails of assailant where it is long, irregular or broken surface, it will be there. And in the case of differential diagnosis in that one, the erosion of the skin can be also produced with the ants, because sometimes after the death, if the death is unnoticed, in the cases of that, the ants can also produce the erosion. And the other verse is excursion of the skin by excreta, some kinds of infant napkin areas, napkin syndromes, etc. Also this kind of abrasions are seen, or otherwise bed sores or the pressure sores in highly dependent areas of the body in the case of paralyzed patients, or in the case of drying of skin. Mainly the scrotum and all will produce reddish brown coloration.